Hello and welcome. Today we're diving into primary lateral sclerosis, or PLS, a rare neurological disease affecting the motor neurons in the brain. While it shares similarities with amyotrophic lateral sclerosis, or ALS, it's important to understand that they are distinct conditions with different progression patterns and prognosis. Join us as we explore the causes, symptoms, diagnosis, and management of PLS. The exact cause of primary lateral sclerosis remains largely unknown. Researchers believe that it's likely a combination of genetic and environmental factors. Unlike some other neurological diseases, there's no single gene that's been definitively linked to PLS. In most cases, it appears to arise spontaneously, meaning it isn't passed down through families. Current research focuses on identifying potential genetic predispositions and environmental triggers that might play a role in the development of PLS. Pathophysiologically, PLS is characterized by the progressive degeneration of upper motor neurons in the motor cortex of the brain. These upper motor neurons are responsible for carrying signals from the brain to the spinal cord, where they connect with lower motor neurons that control muscle movement. In PLS, the upper motor neurons slowly deteriorate, leading to a breakdown in the communication pathway between the brain and the muscles. This disruption results in muscle weakness, stiffness, and spasticity, primarily in the legs, arms, and face. PLS is considered a rare disease. Estimating the exact number of people affected is challenging, but it's thought to be significantly less common than ALS. The onset of PLS typically occurs between the ages of 40 and 60, although it can sometimes develop earlier or later in life. There doesn't appear to be a significant difference in the rate of diagnosis between men and women. The signs and symptoms of PLS develop gradually over time. Early symptoms often include stiffness and weakness in the legs, leading to difficulty with walking and balance. As the disease progresses, similar symptoms may appear in the arms and hands, affecting fine motor skills. Speech may become slurred and difficult to understand, a condition known as dysarthria. Swallowing difficulties or dysphagia can also occur, although they are less common than in ALS. It's important to note that cognitive function is typically not affected in PLS. Diagnosing PLS can be challenging, as there is no single definitive test. The diagnosis is primarily based on clinical evaluation, including a thorough neurological examination and a review of the patient's medical history. Doctors often use imaging techniques, such as MRI scans, to rule out other conditions that may mimic PLS. Electromyography, or EMG, which measures the electrical activity of muscles, may also be performed to assess lower motor neuron function. A key criterion for diagnosing PLS is the exclusion of lower motor neuron involvement over a period of several years. This is crucial in differentiating PLS from ALS. While there aren't distinct subtypes of PLS, there's a closely related condition known as hereditary spastic paraplegia, or HSP-ASP, is a group of inherited neurological disorders that also cause progressive stiffness and weakness in the legs. Because of overlapping symptoms, it is imperative to differentiate it with careful diagnosis. Currently, there is no cure for PLS, and no treatment can stop or reverse the progression of the disease. However, various therapies and interventions can help manage symptoms and improve quality of life. Medications, such as muscle relaxants, can help reduce spasticity and stiffness. Physical therapy and occupational therapy can help maintain muscle strength, flexibility, and range of motion. Speech therapy can assist with speech and swallowing difficulties. Assistive devices, such as walkers, canes, or wheelchairs, may be necessary to maintain mobility as the disease progresses. Regular monitoring by a neurologist is essential to adjust treatment strategies as needed. Because the cause of PLS is largely unknown, there are currently no proven methods to prevent the disease. Researchers are working to identify potential risk factors that could inform future prevention strategies. Maintaining a healthy lifestyle, including regular exercise and a balanced diet, may help promote overall neurological health, although its direct impact on PLS risk is uncertain. The prognosis for people with PLS varies. Generally, PLS progresses more slowly than ALS, and life expectancy is not significantly reduced. Many individuals with PLS can live for decades after diagnosis. However, the progressive nature of the disease can lead to significant disability over time. Recent research efforts are focused on identifying potential biomarkers that could help predict disease progression and response to treatment. Clinical trials are also underway to evaluate new therapies that may slow down or halt the progression of PLS. While there are no breakthroughs yet, ongoing research offers hope for improved treatment options in the future.